Heavy snoring, restless sleep, or very little sleep at all could be signs for a bigger and even dangerous threat to your health. But there are some things that you can do, important steps you may need to take to treat sleep apnea. We've got Dr. Campbell, who has more on the subject. Good morning, doctor.
Good morning.
So first, tell our viewers what sleep apnea is exactly.
So sleep apnea occurs when your breathing disrupts sleep.
Okay.
If you have someone with loud snoring and you see like they constantly are waking themselves up from a deep sleep, they may in fact have sleep apnea.
I actually have a family member who has sleep apnea, is currently at least being tested for it, and there was a lot of interruption between those snores, so that's one of the signs too, when you hear someone actually holding their breath?
Exactly, and what happens during that time is you're not getting oxygen to your brain and other vital organs, and there can be some serious, significant health benefits related to sleep apnea, such as high blood pressure, heart arrhythmias such as atrial fibrillation, and even heart failure, all related to disordered sleep.
So how do you actually diagnose sleep apnea?
First of all, it really is important for the family member to talk about what they notice with their family member at night. If they're waking up frequently, snoring. Other ways that we diagnose it, most importantly, is a sleep study. You can do this at home where we monitor your brain waves, we monitor your sleeping, and we monitor your oxygen levels. And if it drops and you keep waking up, it's likely you have sleep apnea.
Okay, so after it's been diagnosed in someone, how is it treated?
There's lots of different ways. In mild cases, diet and exercise, losing weight can help you, because one of the risk factors is being overweight, over 40, being a man. Those are important risk factors to know. If you have a more severe case, you can use something called CPAP, and it's a machine that blows pressurized air into your nose and mouth and keeps your airways open. For the most severe cases, we can do surgery and remove large tonsils and create more room in the throat.
But the main thing is to get tested if you think or suspect that someone you love, someone you know, has sleep apnea, or perhaps you have it yourself.
That is so important, because one of the great things about sleep apnea is it's very, very treatable. We're able to reverse the effects of sleep apnea if we get it treated.
Always letting our viewers know exactly what they need to do to make sure they protect their health. Dr. Campbell, thank you so much.
Thank you so much for having me.
And if you have a question for the good doctor, you can send him a question. Go to our website at WNCN.com and search links we've mentioned. You'll find all of Dr. Campbell's information right there.